Good morning. My name is Rachel Black and I'm here to talk about my study, which aims to investigate the effectiveness of an online EMDR intervention for women who have had a previous negative breastfeeding experience. And for my research, I want to try and answer the question, can a community-focused online EMDR intervention improve breastfeeding outcomes for pregnant women who have had a previous negative breastfeeding experience? And this is because the literature shows that women who've had difficult breastfeeding experiences are less likely to breastfeed again. It can affect their self-confidence and can even create a fear of breastfeeding. And recent research looking at breastfeeding experiences has found that women who had to stop feeding before they were ready described how they were left feeling bereft. They were traumatized and filled with grief. Now, to many people out there watching, breastfeeding trauma may seem like quite an abstract concept. However, if a woman's breastfeeding experience has not gone well and she's experienced a lot of physical pain or struggled with the prospect of having to give up before she was ready, then the idea of a psychological breastfeeding trauma doesn't seem so far-fetched. And there are many definitions of trauma. And one provided by Anderson and colleagues stated that individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has had lasting adverse effects on the individual's functioning and their mental, physical, social, emotional, or spiritual well-being. So I think when women share their subjective experience and describe it as traumatic, then that in itself shows that it's had a lasting impact on their emotional well-being. So with women experiencing so many adverse effects from negative breastfeeding experiences, it poses the question of what we can do to help. Well, the intervention I'm developing uses EMDR therapy, which is eye movement, desensitization and reprocessing therapy. And EMDR can be used to help people with symptoms of trauma. It can also help depression, grief, and anxiety. And this is because the guiding theory behind EMDR is known as the adaptive information processing model. And it suggests that the symptoms associated with each are actually a result of unprocessed memories, which haven't been linked properly to the existing memory networks within the brain that hold more adaptive information. So basically, when we experience an upsetting event, our brain can get overwhelmed and it can struggle to process the memory properly. The memory can then become stuck in an ancient part of our brain, known as the amygdala. And the amygdala is in an area sometimes referred to as the reptilian brain. And this is the red area that you can see on this image. And this can cause all of the feelings and smells and sounds that were experienced at the time of the event to remain very vivid and can potentially cause reliving of the experience. So EMDR is actually used to help unstick those memories, to enable the memory to become desensitized and reprocessed by the newer, more thinking part of our brain, the cortex, which is the green area that you can see there in the image. Now, during an EMDR, a client is asked to think about the traumatic event while also moving their eyes in a side-to-side movement. And this seems to stimulate the brain and helps to unstick the memories so that the brain can process them properly. And this effect is thought to be similar to the way REM sleep works, when your eyes move rapidly from side to side during your sleep, just as you process the day's events. For my PhD study, I'm incorporating the element of community along with EMDR, as research has shown that not only is trauma healing found to improve with connection, but that women who feel supported have better breastfeeding outcomes. And I will assess if the intervention lowers perinatal anxiety and whether breastfeeding self-efficacy is increased. The impact of these will then be looked at alongside the woman's intention to breastfeed versus their actual breastfeeding behaviour when their baby is born, to see if there's been a relationship between them. And ultimately, I hope that by receiving the EMDR therapy, the negative symptoms that are associated with their breastfeeding memories are reduced, so they're no longer troubled by them. So why is this study so important right now? Well, now that the COVID-19 pandemic, the impact has become clear on breastfeeding outcomes, and indeed the protective impact of breastfeeding, it's important to understand how COVID could actually be compounding on these feelings, and why an intervention to address women's potentially traumatic breastfeeding experience is so important. Firstly, many women will be reading about how breastfeeding could be a way to actually protect their infants from COVID. And you can imagine how, if they're struggling with the idea of breastfeeding again, it could potentially create more anxiety and more feelings of guilt. And yet, breastfeeding itself can reduce anxiety if all is going well. Therefore, creating an online EMDR intervention that's accessible to women has become even more important. As part of the worldwide response to COVID-19, many mental health clinicians moved to online work. And a global survey that was conducted by the World Health Organization found that out of 130 countries worldwide, 93% had had disruptions to mental health services, and 70% adopted teletherapy to overcome this. And last year, myself and my supervisory team conducted a systematic review into the effectiveness of online psychotherapy for women in the perinatal period, and it highlighted 3 key points. Firstly, online psychotherapy is effective in improving clinical outcomes for women in the perinatal period. It also highlighted there's no research into online EMDR for perinatal mental health. And finally, there was no research into online psychotherapy for perinatal mental health that was delivered via video conferencing platforms such as Zoom or Microsoft Teams. So, developing a way to help women heal from breastfeeding trauma using online interventions which are accessible not only in a pandemic, but also when women are breastfeeding newborns is so important. And it demonstrates how technology can be utilised in maternity services and mental health care to support women during the perinatal period. Thank you for listening today.